Hi, my name is Marwan Sheikh. I'm a reproductive endocrinologist, which basically means I'm a fertility specialist. I have been in practice since 1986. I will talk today about weight effect on reproduction. As a physician, we try to go by something called the body mass index. Body mass index is an index that will reflect the patient weight and height. So it's basically the patient's weight in kilograms and height in meters square. The only thing you need to know is if the body mass index is 30, then the patient is obese. And of course, if the patient is less than 18, is very thin, and that's underweight. Does increased BMI or body mass index affect reproduction? Yes, and it affects it either with being high or being low. Let's talk about the high body mass index. What does it do? We all know that obese patients are associated with very high mortality and morbidity. There is increased risk of cardiovascular disease. There is increased risk of diabetes and hypertension and early death. This is in general, but how about reproduction? In reproduction, there is an increased risk of miscarriage in obese patients. There is increased incidence of lack of ovulation. Women may not produce eggs regularly, hence leading to infertility. There is also increased risk of small babies being born to these big patients. And believe it or not, also very large babies, which is associated with increased risk of cesarean sections. There is increased risk in pregnancy of gestational diabetes and toxemia, which is a disease associated with high blood pressure and occasionally seizures, and it can be very morbid. The other way the increased BMI is associated with decreased fertility is by its effect on IVF, chance of pregnancy. Obese patients have less chance of pregnancy with in vitro fertilization. Obese patients seem to produce very poor quality eggs. Obese patients will need a lot of medication, and the medication for in vitro fertilization is very expensive, so needing more medication makes or means more expense to the patient. The other thing that is a problem with very obese patients, especially if their BMI is over 40, is we cannot do egg retrieval on these patients in the office. They would have to be done in a hospital or an outpatient surgery center. At least in the state of Florida, it is not recommended to do egg retrieval on patients who have a BMI over 40. The question, of course, arises, well, these obese patients, if they lose weight, will that improve the chance of pregnancy? And a lot of times I get patients who are 39, 40 years old, who are obese or very obese, and they ask me, should I wait 6 months before I do in vitro fertilization, try to lose weight and then do it? The answer is no, because losing weight does not improve the quality of eggs or the chance of pregnancy in these patients. And we'd rather do their procedure as early as possible, because age has a significant effect on in vitro fertilization. How about low BMI, the very skinny, thin patients? Well, very skinny patients have problems also with infertility, specifically lack of ovulation, especially patients who are on very restrictive diet or who are exercising a lot, or patients, for example, like ballerinas are noted to have lack of ovulation and lack of menses. They never get their periods. These patients, when they get pregnant, they have preterm babies, premature babies, and small babies born. The good thing, however, in these low BMI patients, if they adjust their nutrition and they gain some weight, they correct the problem, and then they do okay. I hope I answered a lot of questions about weight, and thank you for your attention.